Our next panel is on the community case for optimal, equitable cardiovascular health. Their goal is to help us communicate about the new paradigm in terms that will resonate with the public and strengthen support for health equity and cardiovascular disease prevention. Immediately following the panel, we'll talk with the Honorable Frank Scott Jr., Mayor of Little Rock, to get his insights on persuading the public and business community to support policy and systems change. Now, to lead the panel, we have Warren Jones, Chair of the National Forum. Dr. Jones is a retired captain in the U.S. Navy Medical Corps, Professor Emeritus of Family Medicine at the University of Mississippi Medical Center, and former president of the American Academy of Family Physicians. Dr. Jones?
Well, thank you, John. The themes and words that we use affect public support for population health. The previous panel helped us to understand that the reason that countries spend half of what we spend on healthcare and get better results than the US, is it that our spending is concentrated downstream of medical care? Other countries invest more than we do in root determinants of health, such as education, housing, transportation, and food security. If losing ground on hypertension control, increasing the incidence of heart disease in younger adults, and rampant heart disparities do not make clear that the US needs to make a change in its spending in healthcare, the disparities in the COVID-19 era pandemic that Steve Sidney documented in the new National Forum Signature Report have made this plainly evident. But to venture off in a slightly different direction, but equally important, all of us who are here today virtually must become more effective advocates for investing where our healthcare dollars really matter, upstream, on prevention, and on the socioeconomic determinants of health. This panel will help us to build on and broaden public support for our new normal that prioritizes health equity and invests where it matters. Joining me on this panel are three wonderful individuals with deep and differing expertise, importantly, documented successes in what they do to impact public persuasion. Celinda Lake is president of Lake Research Partners, a storied public opinion research and political strategy firm. And we're wonderfully glad to have you here with us today, Celinda.
Thank
you. Rosy McGillan is the Chief Marketing and Community Communications Officer for the American Red Cross, and formerly head of the Global Purposes Practice at Porter Novelli. Rosy is also a National Forum board member. Glad to have you here with us today as well, Rosy.
Thank you.
Immediately after this panel, we will have a conversation with Mayor Frank Scott to get his insights on building public support for policy and system change. John will take care of that for us. Okay, so let's begin with Celinda Lake. How should we frame our agenda to broaden its appeal to the individuals we're hoping to reach?
Really, really good question. And I'm just delighted to be on this panel and delighted, Dr. Jones, with your insights and your own research. And then to be up with Rosy is really, I'm going to learn as much as I'm going to share, I know. So I'm delighted to be here. First of all, the public is way ahead of the national dialogue in this regard. The public has for some time supported prevention, supported increased investment in prevention. Women voters who are the healthcare voters are very prevention oriented. Voters also pretty strongly believe, and more so now with COVID than ever before, that everything is interconnected and that we do have to look at the roots. If we're going to make the changes we need to look at education, housing, transportation, and food security. And that all of these issues have major, major health consequences. So those are two opportunities. There are two limits as well, if you will. One limit is that everything is seen through the COVID prism right now. It used to be that when people talked about their health concerns, that was 20% this, 20% that, 20% the other thing. Now it's 60% plus COVID. It just really dominates people's conscious reactions, and it's the prism through which they see everything. Although that adds to support, for example, for a government involvement, including federal government involvement. The other barrier that we have is that the prism through which most people see healthcare, particularly most voters, and most voters are insured, is a rising cost of healthcare. And that is what they bring to the table. Their awareness of the impact of medical debt, their sense of precariousness because costs are going up now, including prescription drug costs or prices. And so they're bringing that cost lens to the table rather than their investment lens, which they completely support, but they tend to be focused on rising healthcare costs right now. And that's where they are most motivated to make change, or they most want to see action.
Excellent points. Thank you. So how would you describe the different slices of the US population to whom we have to appeal? Everybody's aware that we're segmented. Okay.
Right.
So how would you describe those various slices that we have to be effective in appealing to?
Yeah. So there's a great deal of partisan polarization right now, but interestingly, this agenda, particularly an agenda of prevention, is not that partisanly polarizing initially. Democrats, independents, and Republicans are often very supportive. Now, they differ a lot on what they want to call the healthcare system, et cetera, but they agree a lot on this agenda. We do see some big differences by gender. Women are the healthcare voters. And this is an amusing statistic that healthcare is the one issue where men admit that the women in their lives tell them what to do,
Yes.
when to get in, when to go to the doctor, who to vote for. There may be many other issues where that's true, but this is the one where they admit it. And then there's a big age difference, and it's really three different cohorts. You have young men and women who tend to see themselves as pretty invincible, although are very prevention oriented. Young women more so than young men. Young women very engaged with the healthcare system, young men less so. You have middle-aged America, which is the most, tends to be insured through their employer and brings that prism. They're the ones really driving the healthcare cost agenda. And then you have seniors who have a very different perspective, engaged in a very different healthcare system. And so we have these three different age cohorts. There are also racial differences as well, and racial differences in terms of people's historic and current trusting of the healthcare profession. But across the board, people tend to be pretty supportive of prevention.
Well, you know, the way you laid that out makes it so clear for us that we have to think about how do we touch bases with the critical components of our society in order to have an overall effect. What messages do you feel would resonate with the different slices or different segments you just described?
So, of course, as a pollster, and Rosy will laugh at this, the first thing I'm going to say is we need more polling on this because Dr. Jones, because things are changing and there are new opportunities and new barriers. So I think we don't have in our pockets the very best messages, but we know some things that are strong. The data, and you've presented some really powerful data on this, and the previous panel discussed this as well, that we know that prevention saves money in the long run, and people believe that. They have no idea of the amount of money. You had shared with us $1.24 trillion.
Yes.
That's an astounding amount. That's a reconciliation package worthy number. But people have an instinct that this would save money. This is an investment that will pay back, but they're coming to the table to get their own healthcare costs down. Secondly, we know that guarantee is really a strong word, stronger than government, stronger than private. Guaranteed is what people really want. And we know that the language of inclusivity for everyone, for all Americans, is very, very strong right now.
Yes.
People don't see this as a policy that they want determined based on your income or determined based on your race. They want it to apply to everyone. They want it to be tailored to everyone because they think the patient should come first. And that's a dominant frame that people are bringing to the table right now.
Great. Wow. Now, so you've given us some good messages that may resonate, but is there any language or any phrases or any terms that you would recommend we avoid?
Yeah. You know, we tend to work for the more progressive folks out there. And it's very common in those conversations to hear the word single payer, to hear the word government healthcare. Those don't test as well. And in fact, we did the original focus groups that still amuse people during the Clinton era when the seniors were saying, well, just tell the government to stay out of my Medicare.
Yes.
So that's an important issue. And so that language, bringing in prevention more. And this is where it's a little trickier. Prevention tests very well, and women in particular wonder about why can't we prevent anything? But people really feel that they were kicked in the stomach by the Delta variant. And now they're wondering, it's cynicism often, not opposition, that is our major barrier. People wonder, can we prevent anything? Will there be another variant? When does this stop? We're so divided. Why can't we come together on this? Will our political leaders use this as a political football, or will they come together to do something? So cynicism is a major, major issue. And what helps a lot here is to give examples where people have pulled together to get something done. That really helps overcome and empowers people. It is also true that healthcare professionals, public health professionals, people involved in the healthcare arena, very, very popular. A lot of issues have no trusted spokespeople, but it's still true that doctors, nurses, pharmacists, public health workers, all of these folks are pretty trusted by the public right now.
Those are critical points to make, and we thank you for making them. Right now, in an environment where there's so many confusing messages, each individual having, as you pointed out, their own trusted source and reliable source of information would be really something to call upon. So thank you for sharing that, and we'll come back to you in a few moments, okay? I'll now turn to Rosy. Rosy, thank you for your patience, and how should we communicate our agenda to the people that we want to reach and the people we need to reach in order to affect change?
You know, the way I look at it is not so much the terms of what we are saying, right? As Celinda talked about, you know, there's a lot of, I'm always a big fan of polling and testing around things that are, you know, evident that they've worked. But a lot of the way that I'm looking at it increasingly, and, you know, in particular as a communicator and as a marketer, is not so much what, but how, and what are the channels that we're using to communicate, right? We need to think really carefully about the channels that we're using to ensure that they align with our target audience's channel preferences, right? We've got to meet them where they are, you know, regardless of whether we're talking to advocates who, you know, are trusted voices for the general population, or if we're talking to individuals directly, if we're talking to healthcare professionals. At the end of the day, everybody's a consumer, right? Everybody is getting increasingly used to convenience. I'm going to get my messages where I want them, when I want them, on the device that I want them on, yes, at the time of day that I want them on. And we've got to increasingly adapt to that reality. Constantly thinking about how can whatever the messages we're delivering be as conveniently delivered as possible. You know, we want our information in a format that's quick. We know this, that it's easy, but it's also about how do we make sure that it's part of our everyday routine, right? You know, and I think what's key here is using a broad mix of channels. You know, the days of top-down messaging from government entities, from government organizations, it doesn't work anymore, right? And part of this new normal is channel selection, channel mix. As you look at, and I look at this data all the time as I'm thinking about how to communicate to people about blood donation or volunteerism or whatever it might be from a Red Cross perspective. But if you look at Nielsen is a leading provider of data around information consumption, media consumption. And I want to say the last data I looked at, somewhere in the neighborhood of 3.25 hours is the amount of time that the average adult in the US spends on their smartphone. That's up from, somewhere in the neighborhood of 2 hours in 2018, right? It's just sort of skyrocketing. Radio, that's a resource that people go to for informative information in many ways. It's going down a little bit, but on average, US adults are spending more than 1.5 hours with radio as a resource, right? Another channel that we ought to be thinking about, streaming. I think all of us probably streams a little bit during the day. Doesn't matter what the information is we're trying to convey. We're not being frivolous for looking at an entertainment resource. It is about the channel that's going to get to somebody. Streaming, 25% of people get their TV through streaming today, right? So it used to be people in the, let's say, 55 plus range. You're thinking traditional network TV news. You go through streaming channels now. So I think the key message there is how we're using it and what that channel selection is, as much as it is about what are the words that we're communicating, making sure that we've got content in video, right? That it is digestible content that, again, is just platform personalization is going to be key.
Ooh, you really loaded my rice bowl up with a lot of issues to figure out about how to communicate. But we've got a much more informed sense of how to communicate now. Well, what should we do differently to complement those messages in a way that will resonate with more people? Because we know that people will go to their usual and customary trusted source of information. But are there any other things we can do to complement that you would recommend?
I think part of it, Warren, is going outside of what we're typically comfortable using, right? So I've spent years and years communicating around preventive messaging that has to do with chronic disease, whether it's cardiovascular disease, whether it's chronic lung disease, whatever that might be. And, you have to get creative. I'll give you an example. So in the COPD space, right? So related, close relative to what we're talking about today. This is an audience that tends to not want to be faced with information about chronic disease. They might be tying it back to smoking behaviors. They might sort of think this is just their lot in life. And what our research has shown us is that they're going to be an audience that likes country music, for instance. They like to listen to the radio. They're not going to go proactively seek out information about their condition. But if we can get them at a place where they're going to be most receptive to messaging, we have a better likelihood that we're going to be able to resonate with them. So in this case, we partnered with the country music industry, right? It's a little bit outside the box, a little bit unexpected, but it's something where we have a better likelihood of not being off-putting, intimidating, and we're going to get a better response rate. And evidence has shown in that case that we've had a greater likelihood of getting people to listen, pay a little bit more attention, have their ears open a little bit more than they typically would. So in that case, what's different is just think about where can we find people, where can we meet them in a way that is a little bit unexpected.
Yes. Wow, great points. Before I go to my final question for you, I wanted to mention something. What I'm hearing you describe is what old folks like me used to call just-in-time information. And also I'm hearing you describe the importance of understanding cultural variances. So culturally and linguistically appropriate approaches are critically important in reaching the kinds of audiences I hear you talk about. Your thoughts on that?
Yep, and I would say the other way that I think about that, or sort of and plus, is, it's the old age statement of, it's not about what you say, but it's about what they hear. It's a phrase we use all the time in communications because it's true. We've got to recognize that people have deep-seated beliefs that are going to factor into how they receive information, what we're communicating, again, whether we're healthcare professionals, whether we're advocates, whether we're communicators, whatever it might be. We need to recognize that the information is highly personal, right? Whether it's cultural, whether it's based on how a person may be raised, what their age may be, whatever that is. And that takes us back to testing or polling in many ways, right? We're sitting here talking about investing, right? And investing in, in the new normal. I, as a communicator, see it as investing in the upfront around that testing to say, are we going to get this right based on what the audiences are that we need to move, that we need to help change their behavior to one that's going to be more preventative. We've got to get that response before we go out broadly with any kind of messaging.
Well, you're clairvoyant because you answered my final question for you. I love it. I love it. I was thinking how fortunate we are to have the benefit of the insight that you ladies bring. So much is out there challenging us in how we communicate in order to effect change. But there was a question that we received from someone in the audience. If there's so much support for prevention, what do we need to do to translate that into real policy? How do we flip the script to move from spending the most healthcare dollars to treat the disease into investing more into prevention? And thank you from the audience for asking that question. I think it's a good one. I'd love to hear either of you or both of you share your thoughts on that.
Well, I think one of the things that we need to do is get more repetition. Unfortunately, right now, first of all, Americans are just absolutely inundated with information and messaging on all kinds of things and all kinds of worries. And they're just having an incredible time trying to sort it out. Mm-hmm. And you have a record number of women, for example, in particular, who are exhausted by the whole thing and are just taking a break. Or they're saying, I'm checking out. And they don't like the division and the information and misinformation. And you have a huge, huge problem with information and misinformation, so that no one knows who to actually trust in all of this debate. And just to add to Rosy's comments, a third of women in particular rely on friends and family for information. Well, either we need to do a better job of influencing those networks, or people need new friends and family, and that's going to be harder to accomplish. Yeah. So we need repetition. We need to be, and I love the way Rosy talked about it, we need to be in multiple channels. It used to be if you got on Walter Cronkite, you got it all. Yes. Now, no, you need to be on multiple channels. It needs to be reinforcing. And so much is coming at people that they don't know what to believe. They don't know what to take action on. And then they're very, very cynical that things will actually happen. It's not the public taking action that's so hard. It's that the public doesn't believe their elected leaders will take action, even if they do push for something.
That's great. Rosy, was there anything you wanted to add to that?
The only thing I would add to that is in terms of the repetition, as we think about the messaging that we are repeating, wherever we can be thinking about this as storytellers, right? How do we make sure that we've got something that people can be identifying with, whether they're a policymaker or otherwise? Do they see themselves in what the messages are that we're communicating? Is it something that is coming from a trusted source? Is it something where they are more inclined to stay engaged a little bit longer? I think that's going to increase the likelihood that we're going to be able to get to a constituent who's ultimately going to feed up to the policymaker. And the other thing I would add is, people have their opinions about our current media landscape, meaning news media. And I, for one, am one that I'm not always a fan. But we do have to recognize that continues to be an incredibly powerful voice to policymakers and to the average consumer. So think about things that are going to give us better chance of getting exposure from reporters that we want. So for instance, quotes, they don't always have to come from the top expert, right? Don't waste your time thinking about how do we get, the most senior official. If a reporter sees a quote in, the communication that you're sending out, they're going to be inclined to pay attention to it. They're going to be inclined to respond to things like a very clear, strong call to action. That's something that their readers, their viewers, their listeners are going to react to. So we've got to sort of put our head in the mindset of reporters in many ways, because again, that's a key source of information for policymakers.
Well, I'm glad to hear you. I'm sorry, go ahead.
I'm sorry, Dr. Jones.
No, by all means.
Say is that, and I'd love to hear you, Rosy, talk about this, because I think the Red Cross is like the penultimate of this. I think right now, thinking nationally but acting locally is really, really powerful. And one of the things that I think, thanks to you and others at the Red Cross, whenever I see a Red Cross statement story, I am never at a loss to know what I can do personally, what action I can take locally. And I don't think there's any other organization out there that has that formula down the way you do. And there are lots of reasons for that, but that seems to be a very important component. And I would love for you to lift some tips up on that as well, because I think you do it better than anybody.
Well, I appreciate that. Thank you. We do try very hard at that particular element of any kind of communications or information that we're sharing. And one of the ways that we do it sounds pretty straightforward, but we look at any kind of how to help related communications, right? Make it very easy, create a very specific action that's in a how to help segment of a website or of a digital news source, focusing specifically on, okay, people who are going to look for, how do I help? How do I contribute? How do I make a difference? That's language that people seek, and that's where we pop our information in, right? We think about what are the things that are going to pop up for people, and then we make sure that our messaging is in there. And I think, think nationally, but act locally, Celinda is spot on. We're always thinking about how do we make this very personal in terms of what is the action that you can take in your backyard. I think one of the things that I have learned from COVID, and I think has been an observation from a lot of folks, is it sort of shifted people, whether you were a large employer, it shifted their mindset to, when they think about where they're contributing their dollars or where they're providing support to their employees, it went from, I want to make a big impact, to what is my family, if you will,
Yes.
What is my neighborhood experiencing right now, and how do I help improve it, whether it was the restaurant that was going to close if I didn't give them my business, or my employees who need something very different from a mental health perspective. We all sort of shifted locally in many, many ways, and I think that's here to stay.
And it's amazing that you've been able to master the messaging in that way. There's some entities that will strive for, how do I provide the most thought-provoking message? Well, but that's not what you seem to do. Your message comes across as, this is how you can make a difference for the people you care about. And oh, by the way, it doesn't make a difference if you're a CEO or a laborer. These are terms and actions that you can do to improve things for the people that mean most to you. And that's the way we've got to approach this as we figure out ways to change the policy thinking around prevention. So one of the things we have to think about is, how do we shift the priorities from maximizing revenues and profits in healthcare? And I'm old enough to remember before the times in healthcare, before healthcare was traded on Wall Street, when it was actually done in the community and in the cities and in the states. Okay, but now it's a significant part of the GDP. So how do we go about it? Minimizing the profits and focus on eliminating disparities and keeping people healthy. What's the winning message to accomplish this that either or both of you may see in our last few moments we have? Rosy, we'll start with you.
It's tricky. I think again, in this new normal, this post COVID-19 world, I do think there is much greater opportunity for us to deliver the impact message, right? If we look at, data among people from, 18 and up, right? And we ask them, what is it you care about? They want to make sure that where they're working is doing more than just impacting the bottom line, right? They want to see that combination of impact to their community and impact to their family members, as well as whatever the particular business is. And I think, as you look at increasingly at younger generations, they're sort of setting that tone to say it is much more than about the money that you make or how much something costs. It is, what is the impact I'm making to society? And I absolutely believe there is a mind shift that has already happened. Yeah. And it's a matter of healthcare taking advantage of that, learning from things like the sustainability movement, right? The climate movement, or even the way philanthropic organizations are communicating right now. There's a big window right now for demonstrating purpose, demonstrating impact, and connecting that to what an individual behavior can do in that space.
Great. Thank you very much. Celinda, any points you'd like to share on that?
Yeah, I think I would just build on this and add 3 points. One is show people that we can be successful. People are really down and out, and they're really depressed about being down and out. And I think showing how, and what we find is even when we're advocating for political action, like go vote this issue, go hold your elected officials accountable, it's actually testing better when you combine it with other things like go vote and speak out on this, or go vote and do this to make a difference. And Rosy, what you said, and I know you must be seeing it in the Red Cross work, the millennials and the Gen Xer and the Gen Zers really strongly feel that way. Second thing I think is people, women in particular, really wonder, why can't we make anything consistently better? Why is it one step forward, two step back? Why is it so volatile? Why can't we seem to prevent anything? And so I think that is a very, very strong no, news you can use, 10 tips, things we can make a difference in. And then I think, and this may be a little harder because I've seen less on this, although I thought your own data, Dr. Jones, was very powerful there, how we can reduce healthcare costs and prices when we take preventative action. Yes. And not how we can do that globally, but how we can do that for individual families.
Great. I got a lightning round for you. We've talked about some significant changes. Which voters you think are most likely or open to supporting agendas of decreasing the cost of decreasing the just-in-time costs at a high cost and going for more upstream expenditures similar to the rest of the world? Are there any particular types of voters that you think would be more inclined to do that?
So college-educated women under 50, particularly moms, and progressives would be my candidate on that. And also the Latinx community. The Latinx community, a lot of Americans could give a damn less what other countries do. That often isn't very persuasive, even to some of those audiences that I mentioned. But the Latinx community, much more globally aware, and tends to use that as a yardstick to compare more. So those kinds of global comparisons are very persuasive to Latinx voters.
Great. Rosy, any thoughts?
I would agree 100% with Celinda's point of view there.
Great. Thank you. Another lightning round question. We've talked about some of the cynicism that's out there. Are there any things that you can do, any types of leaders you feel can help us to decrease the amount of cynicism that's out there that you talked about, Celinda, and that you alluded to also, Rosy? Any thoughts?
I would say increasingly what we're finding is a message of hope is resonating much more so than doom and destruction and disaster. It works much more effectively for us. And what I would add to that is any chance that we have to demonstrate the upside of the actions that we're recommending, the policy changes that we're recommending, I think is particularly relevant right now.
Great. Okay, Celinda.
I would just build on that. And what we say in our business, and we've done quite a bit of research on this now, affirming a positive, providing a vision of a positive works much better than ameliorating a harm. Most of our messaging in this area is often framed as ameliorating a harm, but actually right now that makes people feel depressed. Affirming the positive, giving the vision, we can get this done, we can make this better, actually tests a lot better as well. So I would totally agree with what Rosy was saying.
Well, you
I
know,
sort of feel like, as we tie this back to trying to, drive a certain action, people want to right now be able to see that what they are doing is going to make a difference, that we are coming off of 18 months, 19 months of incredible helplessness. And what can we be doing to give very concrete examples of how X will drive to Y?
And it's amazing. The points you make are so salient right now. They're so poignant and so clearly obvious. I think of a tagline that the Association of Black Cardiologists used to use, which is that children should know their grandparents. And the impact of not engaging in enough prevention is really flipping the switch and making that more of a challenge today than it was a while ago. Oh, I'd like to thank you, Celinda Lake and Rosy McGillan, for sharing your wisdom, your insights with us today. It's been a delightful time together, and it's gone by so swiftly. And I'd like to say to our audience, we've all got to work together to build on and broaden support for health equity and most importantly, prevention. I hope you agree that this has truly been an enjoyable and informative panel. We hope that you continue to enjoy the meeting and have a wonderful day. I'll now turn things over to John for his interview with Mayor Scott. Thank you so much and have a great day. John?
Thank you, Celinda Lake, Rosy McGillan, and Warren Jones. To get another perspective on building public, business sector, and political support for prevention and health equity, we turn now to the Mayor of Little Rock, the Honorable Frank Scott Jr. And Mayor Scott is going to help us translate what we just learned from Celinda Lake and from Rosy McGillan about communications into real-world practice, into building support across the community for this vision that our initial panel sketched out. Mayor Scott, you've been successful at building support for change. You understand that this first panel has sketched out bold change to the system so that we're investing more where it matters to help people be healthy from the beginning of life and to stay healthy throughout life. And yet that's very different from what the system that we had before the pandemic hit. So as you're thinking about how you, if you were leading the charge here, how you would sell that in Little Rock and across the state perhaps, where would you start? How would you appeal to people? How would you relate to people's priorities and concerns with that agenda?
Well, John, thank you for this opportunity to share on a very important cause and mission, and I dare say ministry, to help all people. When we think about this national forum and we think about healthcare, but we also speak to healthcare disparities. And I think one of the things that we've learned throughout this brutal and ongoing pandemic, no one, to my knowledge, has been alive since we had the last pandemic. So things are a lot new and different. But one of the things that we really realized is what it truly means to experience healthcare disparities when you deal with the COVID-19 pandemic. Secondly, understanding healthcare disparities, we have to first understand educational awareness of health issues and how they impact not only people, but our communities. And this is a true public health concern that ultimately creates a true workforce concern. When we think about education, economic development, one thing sustains those two, and that's proper healthcare, access to healthcare, and an understanding of healthcare. And so when we think about those are things that we have to share with the various communities that are most impacted. And when we share that, that's how we're able to persuade. And we have to do it in a very clear and concise, but coordinated fashion to communicate and to be very intentional with the messages that we use to truly gain the attention, the awareness, but ultimately to change minds through action-oriented policies. But not only the policies, but to make sure the people that it most has the most greatest impact that they follow through.
All right. That's the follow through is really important there. So, Mayor Scott, one can imagine getting support from the public, particularly the members of the public who will benefit. You, I think, just did a great job of making the link between people's health and the vitality of the community, the resilience of the community. Does it help to have support from the business community to bring about policy and systems change?
Yes, but not only the business community. I think many times we hear the word P3, public-private partnerships. I think we also have to add a fourth P, and that's philanthropy. And I think when you have more resources that are addressing the issue, it helps ensure that the message is not only getting to the people, but at all modes and mediums for communication. So I definitely think we have to have our partners in the business community, the NGO community, faith-based community to really show how this is impacting people and their respective customers and constituents.
That is such a good point. And how would you approach the business community and the philanthropic community to help them understand that they will benefit or their mission will be advanced by
Well, I think with
supporting
anything,
this agenda?
I think with anything, you have to understand how businesses work and how they approach solutions to their issues and bring the business case for the business, but also the value proposition for not-for-profits and other organizations. And once you're able to demonstrate the need, the why, but the value proposition, that will ensure that resources are available, accessible, but attributed to the areas that needs to be focused on.
So we're talking about directing investment in safe and secure housing and in education and access to nutritious food to areas of the community where those are most lacking today. So it's big change. It's change to the status quo. If you're selling that vision to the people of your city, where do you start with that?
One, you have to, when you're focused on change, I think it's always good to share the facts, share data, to ensure that that one isn't going about change on a whim, because just like there's directed investments, you have to understand why there's a need for those directed investments. And many times we as elected officials are hesitant to share that information, but you have to make it plain. And when you really show those stats and you show that you're making data-driven decisions, and albeit intentional decisions to go about with bold change, it's a must, it's a necessity. Change is a continuous struggle. And understanding that when we go through change, we have to be intentional, but directed, but utilizing data to share the same vision, the why, and the value proposition, just as we would with any business case.
All right. Well, I think those of us who are in some way a part of the public health community have been advocating for a long time for a higher priority on prevention, for keeping healthy people healthy, for closing disparities in health. And yet right now, we're still looking at 95 cents out of every dollar that goes to health in the US going to treat people, diagnose and treat people after they're sick rather than into prevention. And there are a lot of jobs that are tied to fixing people after they're broken. And not that we don't want to do that, but I think most people understand it makes sense to keep your car running well rather than just let it break down and have a big repair bill and be without its use for a while, and that the same applies to our bodies. But again, that's a big change. It requires, honestly, disruption. So where do you start in building support and in the messaging? Do you go to the grass tops? Do you go to the grassroots? Is it a combination of those? Where's your starting point, Your Honor?
It's all the above. You have to meet people where they are. Again, I'm going to keep harping sharing the why. And as you start that process, I think it's always imperative is to listen as well to see if there's any particular concerns. But when we're talking about public health and safety and security of affordable housing and what that means to understand the long-term social determinants with public health, we have to get busy. And getting busy is focusing on communication and ensuring that we're meeting people where they are, from a grassroots to grass tops and everything in between. And we do that by constant communication, utilizing data-driven facts, and ensuring everyone understands the true value and the rationale for the decisions that we're hoping to make.
Great. I really appreciate your emphasis on the facts here. I think we all know facts do still matter.
Facts are true.
There you go. A little shameless promotion here. I really appreciate your involvement in Move with the Mayor, and you were just reminding me of it a second ago as you were talking about meeting people where they are and listening, because I know one of the mechanisms that you use for connecting with people and hearing them is Scott Strolls. So can you tell everybody a little bit about Scott Strolls?
Well, thank you so much, John, for the alley-oop. Our Scott Strolls is our way of civic engagement by bringing City Hall to the community to ensure that there's Q&A and the ability to discuss issues and concerns of city-related matters. And so my entire city management team, we go out to all of our neighborhoods. We're getting close. We have 199 neighborhoods. We've been close to 60 to 75. And we're still working, and we bring City Hall to the community to answer any questions, to listen, to learn, and be responsive, and get a good workout in.
There you go, right? So it's a
Yes.
great way to show people that even someone who's as busy as you are, as big city mayor, you can fit physical activity into what you're doing on a daily basis.
You can.
So we appreciate your leading by example.
Thank you so much.
Yeah,
Well, it's been great to be with you. This is just such a great initiative and worthy cause. And I'm proud to be a part of the Move with the Mayor initiative as well.
Well, we're proud that you're part of it, Your Honor, and we really appreciate your taking the time for the conversation today.
Thank you so much.
Thank you, Mayor Scott.